Panic attack versus anxiety attack. What's the difference? Before that, I want you to know this. The term anxiety attack isn't officially recognized in psychiatry, but that doesn't mean it isn't real. People do experience what they call as anxiety attack, and those feelings are very real. But clinically, we talk about these experiences a little bit differently. So, what's the difference between a panic attack and what people call an anxiety attack? First, let's talk about a panic attack. In our brains, we have a kind of built-in alarm system designed to keep us safe. When we sense danger, our brain triggers the release of adrenaline and other stress hormones. This is called the fight or flight response, which prepares us to either face or escape the danger. Now, when it comes to a panic attack, this alarm system becomes hyperactive. Even if there is no real danger, you suddenly feel uncontrollable panic, a surge of intense fear and discomfort. It feels like you're losing control or like having a heart attack. Here, it's important to understand that there's usually a trigger, but it might not be obvious to others or even to you at that moment. It can seem like the attack came out of nowhere, but deep down, there's often something that triggers it. A panic attack can strike in situations like the death of a loved one, when you remember a past trauma, or even during a stressful event at work. When a panic attack hits so intense that you might feel like your life is about to end. Your heart races, your breathing becomes difficult, you might feel dizzy or like you're choking. You might think, this is it, I'm done. It can be terrifying. And because it's so overwhelming, the experience stays with you for a long time. After having one panic attack, you might start fearing about having another one. This fear itself can lead to more panic attacks, creating a cycle that's hard to break. This brings us to something called panic disorder. If you've had multiple panic attacks and are constantly worried about having another, you could develop a panic disorder. It's like being stuck on a giant wheel that keeps spinning. One panic leads to anxiety, which then leads to more panic. The cycle just keeps going. This makes life incredibly challenging because you're always on the edge, fearing when the next attack will come. Now, what about an anxiety attack? Unlike panic, anxiety is a long-lasting fear or worry. It doesn't hit you suddenly. Instead, it builds up over time. Your brain's alarm system is constantly looking for potential threats, even when there are none. It's like living with your alarm system always on, but on a low level of alert. See, anxiety attacks often starts with a feeling of unease. Maybe you've been worrying about something for days or weeks. Over time, this worry starts to intensify. You feel restless, irritable, and can't focus on anything else. Your muscles tense up, and you might feel like there's a weight on your chest. You will feel like it's hard to breathe. Feelings like this do not fade quickly. They last for hours, days, and even months. For example, imagine you've been worrying about a health issue for weeks. You've been to the doctor, but you're still waiting for the test results. As each day passes, your anxiety builds. You start imagining all the worst case scenarios. What if it's something serious? What if the treatment doesn't work? This anxiety doesn't just go away even after you talk to the doctor. You will still be anxious that something is still wrong. Even when you try to focus on other things, anxiety will affect everything you do. No matter how much you try, that feeling of unease just won't leave you. The intensity of an anxiety attack can be paralyzing. You might feel like you are drowning in your own thoughts, unable to escape the endless loop of worry. It's not as sudden as a panic attack, but it's just like a slow burn that doesn't go away. So now, why should you know the difference between the two? Knowing whether you're experiencing a panic attack or an anxiety attack is crucial because the way you handle each one is different. If you're having a panic attack, you need to consult a doctor or a therapist to find out what's causing these attacks. For some, it may be a one-time thing, but it's important you take professional help to prevent them from turning into panic disorders. On the other hand, if you're dealing with anxiety attacks, you need long-term strategies. This might include therapy, lifestyle changes, and possibly medication depending on the severity. Both panic attacks and anxiety attacks are real, and both require different approaches for treatment. Don't ignore the signs and make sure you're using the right tools to handle what you're going through. Thank you for watching.